Thank you, Esther. The World Health Organization has warned that malaria death in sub-Saharan Africa could dramatically rise due to border restrictions and disruptions caused by the global pandemic of the COVID-19 coronavirus. I spoke via Skype to Valentina Buj, Global Malaria and Health Partnerships Advisor at UNICEF, and asked her about the impact of COVID-19 on malaria control.
It is unfortunately a very highly likelihood of the lockdowns. We are hearing many reports that because of the lockdowns, families, in particular children, are not going out to seek care for when they have a fever or when they have other symptoms of malaria. We're seeing some disruptions in the arrival of needed malaria commodities, be they bed nets or be they drugs. As you know, WHO and UNICEF and multiple other agencies have put out a call for the maintenance of essential services, in particular seeking care if you have any of the symptoms of malaria. And it's one of the ways we're really trying to turn around this potential doubling of numbers.
To what extent is COVID-19 disrupting the global supply chain of key malaria-related commodities?
So at the moment, most of the major agencies, WHO, UNICEF, the Global Fund, the US President's Malaria Initiative, are working very carefully to check these supply chains. We're doing everything we possibly can to accelerate LLIN campaigns to accelerate the delivery. In particular, we're doing huge amounts of work on guidance to ensure that community health workers and health workers, who are those who will be delivering malaria services, receive personal protective equipment so that they can be protected when they deliver services.
With all the attention that is being put on COVID-19, how do we ensure that malaria does not fall through the cracks, given that it is still a top killer for children under 5 in sub-Saharan Africa?
We have a small window. So especially in sub-Saharan Africa, the malaria season will be starting in 4 to 5 months. So we need to act now. Right now is the time where we need to invest in bednet campaigns. We need to ensure that we are pre-positioning supplies, particularly diagnostic tests, particularly anti-malarials. And in particular, we need to, again, ensure that people are not afraid to seek care for malaria. So when they do feel symptoms, that they do go and get a diagnostic, that they get the right treatment. Our biggest concern is that we might see deaths going up because of severe malaria. Uncomplicated malaria is very preventable. Sleep under your bed nets. It's very treatable. Take your full course of anti-malarials. And this is the way that we will prevent it going to severe malaria. It's the way we'll prevent it going to health facilities. And it's the way we will prevent overburdening the health facilities. What we see with COVID is that it's really when the health system is overwhelmed that we cannot survive. It's where deaths go up. So the more that we do to prevent malaria now, we get the bed nets out now, we pre-position supplies. That's how we'll keep and maintain the gains we've made in malaria.
Again, children in sub-Saharan Africa bear the greatest burden of malaria in the world. Is there a need perhaps to innovate in finding solutions for malaria control on the continent?
We are working on a number of different areas. As you know, the 24th of April 2017 was the launch of the malaria vaccine, which we're hoping those trials will come out with a successful vaccine which we can administer. We're trying multiple different methodologies to deliver, again, protective malaria commodities, something called seasonal malaria chemoprophylaxis, which is very important in the northern Sahelian region. And we are also beginning to look now at intermittent preventive treatment in infants. So again, looking at very specific area groups to try different methodologies.
What about local solutions? Are organizations such as UNICEF and WHO supporting local communities to find solutions at their level?
I think the most important is support your local community health worker. So we've been doing huge amounts of training to ensure, for instance, integrated community case management. We have proven, and we've shown together between UNICEF and WHO, that community health workers can safely and effectively deliver services and drugs for all 3 of these areas. We are also discussing and working about other point-of-care diagnostics that could help you to discern between what is a bacteria, what is a virus, and what is malaria. And especially, I think the COVID-19 pandemic has shown how important it is to do proper sanitation, good hand washing to protect yourself from viruses.
Now, the African members of the End Malaria Council have released a 4-part action plan calling on African and global leaders to act quickly. among other things, to protect the decades of gains against malaria and continue investments in building an essential health workforce. And that's all for today. To stay in touch, find me on Twitter at Linord Moudou.